Welcome to the Leeds Children's Hospital. This is our safety huddle. Ward 10 is a busy 16-bedded unit which accommodates 3 specialities: gastro, liver and renal. Working with 3 different specialities can be a challenge. Communication is essential for smooth running of the ward, ensuring the care we deliver is consistently high. The first step of the project was to assess our communication skills across our multidisciplinary teams. An audit was performed on the productivity of board rounds. The data showed that often, in times of pressure, our communication could be improved. We identified a need to have a more cohesive start to the day. The huddle takes place on the ward at 9 a.m. and lasts between 5 and 10 minutes. Everyone is welcome. The nurse coordinator for that shift takes the lead. It is attended by medical staff, nurses, pharmacists, dietitians, matrons, clinical nurse specialists and student nurses. The ward has open access to all 3 specialities. Getting together at the start of the day has proved to be extremely successful in dealing with bed issues. Potential problems for admissions can be addressed and planned discharges can be managed efficiently. The group also discusses any unstable children with increased PAWS score. They can then be assessed as a priority. We also talk about any step downs from PICU and HDU, any safeguarding concerns, any child at risk of pressure sore development or falls, any infection issues, any similar names, any complaints, and any staffing issues. Our safety huddle welcomes discussion between the specialities and members of the multidisciplinary team in an informal setting. We have found that this first 5 minutes of the day can be the most productive of the entire shift. We aim to roll out the huddles to the rest of the Children's Hospital as soon as possible.
So this week's Druggle, we have a hot topic about amending existing prescriptions. So for example, I've written out a prescription for sodium chloride. If you ever had a prescription and you wanted to change it from twice a day, as it was originally prescribed, and then change it to once a day, as I've shown you by this illustration here, it's not cool, guys. You need to rewrite it. It says so in the LTHT prescribing standards. It sets it out quite clearly. If amendments are made, the existing prescription must be cancelled and a new prescription written. Interestingly enough as well, it says when rewriting, you need to always state the date that the drug was started initially and not the date that you are rewriting the prescription. And that is the truth for all transcribing of prescription charts as well. It's more than okay for you to write 2 dates and say the date that you are actually writing the prescription, and then write started on and then the date that it was originally prescribed. That's more than okay. But it does say that it needs to be the original date, and that's just for clarity purposes. So the error of the week this week is one of our gentamicin charts, and unfortunately again I have found another chart with no details entered. It's a purpose-built prescription chart. We have designed this specifically for neonates, and these sections are not optional. Unfortunately, we are seeing quite a lot of them not being filled in. It goes against our standards, and obviously it's something that we monitor regularly in audits as well. So when we're filling in the prescription charts, please remember to fill in these sections. If you do find a prescription chart with blanks, I'm more than happy for you to fill them in retrospectively. If you know the original indication and the review date, that's fine. What needs to happen is that these boxes need to be filled, because this is what flags up to us that we need to be looking at reviewing the antibiotics, preventing overuse and making sure they get stopped at the appropriate time. Okay? And for the final slide, for our prescription audit, we've done fantastically this week. So out of the 5 prescription charts that I checked randomly on the unit last week, we had 5 with no errors at all. So that is our first 5 out of 5, which is fantastic. So as well as this, I'd just like to point out, I did say last week, I was unable to collect any data because of the move. Everybody was moving babies and none of the babies were in the place where I thought they were going to be. So this dip here is technically not really a dip. But going up to 5 is absolutely fantastic, and a massive thank you to everyone that has been putting in so much effort on these prescription charts, because it seems to be that the druggles are really making a difference, which is fantastic. So keep it up, guys, and hopefully we can get another 5 out of 5 this week as well. Thank you very much.
Thank you, Kat.
Thank you.